physical therapists, you are experts in the body's mechanical systems. You understand the intricate dance of muscles, bones, nerves. But there is another system, just as critical, that silently governs your patient's ability to heal and move. I'm talking about the immune system. Think of it as the body's dedicated security force. It is a complex network of cells, tissues, organs. Together, they work tirelessly to defend against invaders. These invaders can be bacteria, viruses, fungi, parasites. This defense system is constantly on patrol, identifying and neutralizing threats before they can cause significant harm to the body. First is the innate immune system. This is our rapid response team. It is the first line of defense we are born with. It includes physical barriers like our skin mucous membranes. It also includes specialized cells that immediately attack any foreign substance they encounter. The second branch is the adaptive immune system. This system is more sophisticated. It learns and remembers specific pathogens. After an initial encounter, it develops a targeted memory. This allows for a much faster and stronger response if that same invader ever tries to attack again. This is the very principle behind how vaccines work to protect us. The key players in this system are white blood cells, or leukocytes. They are the soldiers on the ground. Some, like phagocytes, act like Pac-Man, engulfing and digesting germs. Others, called lymphocytes, are the intelligence officers. B cells create antibodies, which are like specific homing missiles that lock onto invaders. This coordinated effort is a beautiful symphony of biological defense. It is happening inside your patients at every single moment, protecting them and enabling the very healing you work so hard to facilitate in your practice. So, why is this crucial for you as a physical therapist? Because when this system goes wrong, it doesn't just affect a single organ. It can create systemic problems that directly impact everything you do. It can cause inflammation, pain, fatigue, tissue damage. These are all conditions you see and treat every day. Understanding the basics of this guardian system is the first step. It helps you appreciate the profound challenges your patients with immune-related disorders face. It provides the context needed to truly understand their pain, their limitations, and their potential for recovery. Your work is not just mechanical. It's intricately linked to this hidden biological battle. The immune system is designed for precision. It must distinguish between self and non-self. It needs to know which cells belong and which are foreign invaders. An immune disorder occurs when this defense mechanism underreacts. The most well-known example of this is human immunodeficiency virus, or HIV, which specifically targets and destroys crucial immune cells. On the other end of the spectrum is an overreaction. This is what we see in allergies. The immune system mistakes a harmless substance, like pollen or dust, for a dangerous threat. It then launches a full-blown attack, causing symptoms from sneezing to life-threatening anaphylaxis. But perhaps the most perplexing failure is autoimmunity. This is when the system loses its ability to tell self from non-self. It turns on the very body it is supposed to protect. It then launches a sustained attack, leading to chronic inflammation and tissue damage. Two classic examples of autoimmune disorders you will encounter are rheumatoid arthritis, or RA, systemic lupus erythematosus, or lupus. In RA, the immune system primarily targets the synovium. This attack causes inflammation, swelling, and pain. Over time, it can lead to joint erosion and deformity. With lupus, the attack is more widespread. It is a systemic disease that can affect the skin, joints, kidneys, brain, heart, and lungs. The consequences of a dysfunctional immune system are not abstract. They manifest physically. For patients with autoimmune diseases like RA, lupus, the primary impact is chronic, systemic inflammation. It is a relentless, body-wide state of alert. This inflammation is the root cause of persistent joint pain, swelling, stiffness, and in RA, progressive cartilage and bone destruction. Instability, deformity, and reduced range of motion limit function over time. Beyond the joints, muscles are also significantly affected. Widespread inflammation can lead to myalgia, a deep, aching soreness not related to exertion. The body's constant state of fighting itself is incredibly draining, causing profound fatigue that limits therapy participation. With immunodeficiency disorders like HIV, challenges differ. The primary issues are infection risk and delayed healing. Minor cuts can become serious, and recovery is prolonged. HIV and treatments can affect the nervous and musculoskeletal systems, neuropathy, muscle wasting, and bone density loss. These impact strength, balance, and overall mobility. Autoimmune care battles inflammation and fatigue while preserving function. Immunodeficiency care manages weakness, neuropathy, and fragile healing, building endurance without overwhelming limited reserves. As a physical therapist, you are often one of the healthcare providers who spends the most time with a patient. This unique position allows you to observe subtle changes others might miss. Recognizing the red flags of a potential or poorly managed immune disorder is a critical skill. Look for bilateral joint pain and swelling, especially in the small joints of the hands and feet. Symmetric symptoms not explained by trauma suggest inflammatory arthropathy like RA. Morning stiffness lasting over 30 minutes is a hallmark. Note systemic signs: unexplained or persistent fatigue, low-grade fever, general malaise. Unexplained rashes, especially a butterfly-shaped malar rash, and photosensitivity point toward lupus. In known HIV, watch for opportunistic infections, new persistent cough, weight loss, night sweats, or new neurological symptoms like confusion, weakness, sensory changes, balance issues, or foot drop. Your detailed, serial functional notes can objectively flag decline. A history with multiple, seemingly unrelated problems suggests a systemic autoimmune condition. Communicate these concerns. You may enable a timely diagnosis and crucial medical management. Understanding the prevalence underscores the urgency. Up to 23.5 million Americans live with autoimmune disease, more than cancer. Nearly 80% are women, a population you cannot overlook. RA affects the 1.3 million, often begins between 30 and 60, with immense personal and economic costs. At least 1.5 million Americans have lupus, primarily women of childbearing age, with higher prevalence among women of color. About 1.2 million live with HIV. Longer lives on ART bring osteoporosis, cardiovascular disease, and chronic pain. Treating these disorders requires a departure from standard orthopedic protocols. In RA flares, protect joints, avoid aggressive loads, use pain and edema management, gentle ROM, and joint protection or splints. In remission, rebuild with gradual strengthening, low-impact aerobic work like aquatics or cycling, and careful flexibility. Do communicate with rheumatology or infectious disease about status, medications, and contraindications. Do educate on energy conservation, joint protection, and the difference between good muscle soreness and bad joint pain. Do assess every visit: swelling, warmth, pain, morning stiffness, and fatigue. Do emphasize low-impact exercise to build cardio fitness and endurance while sparing joints. Don't push through joint pain. It signals inflammation and risk of damage. Don't ignore fatigue. Modify sessions or focus on gentle techniques and education. Don't use aggressive manual therapy or deep heat on inflamed joints. In HIV with osteoporosis, be cautious during manual care. Fracture risk is real. Communicating, educating, assessing, and proceeding with caution create a strong therapeutic alliance. Be a knowledgeable, compassionate guide. This thoughtful approach is the hallmark of an exceptional physical therapist.